Dear colleagues, ladies and gentlemen, it's my great pleasure to present you after long years. And as it was said by Professor Žaludík, that finally also our Minister of Health recognized that something like National Center of Clinical Practice Guidelines is a good idea to have in Czech Republic. So I'm very excited about this, that this is going on actually in our country as well, and we can improve the quality of our healthcare. I will present today some main parts of our Czech national methodology. You can see here the co-authors and my dear friends and colleagues who are methodologists of the project. And also we have already some current results from the beginning. Actually yesterday there were the meeting of the Guarantee Committee which approved next 3 pilot guidelines which were under study. So now we have approved 5 which are now under further evaluation. So I will show you the process here. For my disclosures and conflicts of interest, I have only intellectual conflicts of interest. There are no direct or indirect financial conflicts of interest for me. And about the clinical practice guidelines. So let's speak here a little bit about what's yesterday, today, tomorrow. And you know, since 19th, where the guidelines were introduced actually in our country, compared to Slovakia, we got a huge development of guidelines. So until 2015, we developed actually around 2,000 guidelines. However, there were other expert opinion, but unfortunately not in a way as was introduced by Professor Schunemann. Some of them were of high quality, but let's say evidence-based, however not the majority, unfortunately. So here you can see the number and a huge effort of our physicians who actually developed these guidelines. So until 2017, we got about 1,900 guidelines from more than, let's say, 120 professional medical associations and bodies in our country. Well, how actually all this started? It started actually in small. It started in Olomouc, where developed the Center for Clinical Practice Guidelines, supported by European social funds. And we continue on this work because the head of this project actually is here as member of our team, is Dr. Radim Líčeník, who is sitting here. And in this project we translated most of the international tools that we have, which is Agree, Agree2nd, Adaptee, and other parts. So that's part of the yesterday. Then we got in the meantime one attempt to try to start National Center for Guidelines, but unfortunately this was not successful. So from the past for today, we have here several tools and very smart methods we can use for the development of guideline, like it's a great method from Great Working Group, that's where Professor Schunemann is, Guidelines International Network, which comprise of most of the national centers or centers for clinical practice guidelines development. Adaptee is a tool for adaptation, which is improving because the tool is now quite outdated. However, the group under the GIN is still working on improvements, Agree and some other which we are using. And this is today, and this is the picture of our national portal of clinical practice guidelines, which is online. That's actually where you register for the conference. So if you browse a little bit more, that was a portal where you can find all information about the project, but also you can find there published other national methodology and also some other workshops and parts what we do in our country. So, because we don't think that the EBM and the methods for guidelines are great from the beginning, like was LADA, actually on this picture, we think it's more like a BMW, so it's still evolving. So our methodology is also evolving with it, and we are actually looking every year what's new, and we adding the new ideas to develop trustworthy, evidence-based practice guidelines. And some idea for tomorrow. This was the great event which we, most of the colleagues, directors of the JBI, which was co-organizing this, as well as the colleagues from Cochrane collaboration, Campbell, Gin, and others actually been first time together. It's a milestone. It was a joint symposium of all of those, let's say, most relevant organizations in the field of the evidence synthesis, clinical practice guidelines, which was called Global Evidence Summit. And actually, during the summit, came to our mind idea to actually do something in smaller size in here. So it's my great pleasure to introduce you our Czech National Center for Evidence-Based Healthcare and Knowledge Translation, which is kind of for tomorrow, because the official opening will be during the gala dinner of the two very important centers and collaborators, which is the Cochrane Czech Republic, which was approved quite recently, and we will officially open this center during the gala dinner, and Masaryk University Great Center. So that's the worldwide most important methodology for evidence synthesis and guidelines, and we are very glad that actually we have all under the roof here in Faculty of Medicine, Masaryk University. But as I said, this will be for tomorrow. Well, development of clinical practice guidelines is a systematic approach. Yeah, so with clear steps, rigorous steps, which we have to follow, also regarding the expert opinions. So what methods actually can we use for the guidelines development? Well, opinion-based guidelines, it's part of the history, consensus-based guidelines, and currently the trustworthy evidence-based guidelines. So that's where we are heading with our methodologies. Well, there are several methods what we can do. The method which is the most time-consuming and very complicated, because you have to develop systematic reviews, is a full process development of the guidelines. It could be 2 years, 3 years, it depends on a number of clinical questions what we have in the guidelines. If you look to some big guidelines, there could be around 100 clinical questions. So you can imagine what's the time and effort behind this. So it's maybe not the best idea to still reinventing the wheel, but actually better to look somewhere around if there exist some high quality guidelines which could be adapt or actually adopt. Adoptment is a method which was introduced by the Great Working Group. It's a paper, very nice paper in 2017, and we already incorporate this into our national methodology. So this is the project I mentioned. The project started officially actually 1st of January. There were a few delays, however, we are now on a schedule, on a time, and I will show you several results what we already have. The principal investigator of this Czech national project is Czech Health Research Council, and the first partner is the Ministry of Health of the Czech Republic, and second partner is the Institute of Health Information and Statistics of the Czech Republic. Our methods there, as I said, it's what we want to do here is trustworthy evidence-based guidelines to actually unify the methodology and to develop it in trustworthy way. The main methods so far for us were adoption, adaptation, development, because this project is for 5 years, and we have to develop 40 guidelines. So you can imagine what's the work and effort behind this, and that's a lot of work in front of the team. Few guidelines will be fully developed, but the main method will be the adoption, adaptation, and development. So the question for us in the beginning was, what methodology to use? So there were some ideas that we will actually reinvent the wheel, but we are smarter than this, so we look if there exists something we can actually use, which we did. So there is a lot national guidelines which are published, which are available, which you can look at. However, the great effort from the colleagues from McMaster University, so there is the McMaster checklist, which actually systematically reviewed all national existing guidelines. So that's a great resource for the national methodology, and our methodology is based around this, of course, and around the great methods. For the critically appraising of existing guidelines, of course, here is standardized tool. We have this translated into Czech language, it's also translated into Slovak language. I mentioned it was during the previous project. And here finally, if you go to our portal, so this is the methodology, what you can find. There are 3 documents and which guiding our clinicians to develop the guidelines. And within the project, here is a team of methodologists who are actually developing the guidelines together with the professional teams and helping them to follow the methodology. So this is how the guidelines look like on the picture. And to be trustworthy evidence-informed guidelines, they will be adopted, developed. They will adapt these guidelines if they use great methods. Fully great methods, because what you can actually see all over the world is that many people are saying, many guidelines are saying we're following actually the great methodology, but if you look closer, you will see that they're just taking some parts, which is not very smart, because if all international collaborators use this methodology, it will be very, very easy to adopt it and adapt it. That's also our experience. The newly developed following Czech national methodology, which is based on the GRADE, be informed by well-conducted systematic reviews, consider the body of evidence for each outcome, including the quality of that evidence and other factors that actually influence the process, making recommendation, including benefits and harms, values, preferences, resource use, and acceptability. So that's the main part for the guidelines, which I put here. So now let's look to the projects and some of the results and the rationale behind the project. So the reason for the need to create clinical practice guidelines came from current problems of the Czech health system, what we have. So we're facing significant heterogeneity of care, which is conditioned territorially depending on healthcare provider, for example. So there are differences in quality of healthcare in different hospitals in our country. The absence of unified, consistent methodology of creation of guidelines, this is something we've seen, and you've seen these huge numbers. Each of these guidelines has different methodology, different quality. So this is something which this project trying again to improve. The frequent inefficiency of spending money, another big issue that we can see from overdiagnosing, inappropriate diagnosing treatments, all of these which actually we can experience in some places. Some are excellent, but some are not. The project goals are to reduce heterogeneity of care, to create clinical practice guidelines with a unified standard methodology of their creation, set up standard healthcare, let's put it this way, potentially increasing the effectiveness of spent financial resources, and of course, deepening, improving the postgraduate, postgraduate education, because these guidelines will also be used, of course, in teaching of medical students, and later on when we develop guidelines for allied health professions, so also other allied health professions. The aims of the project to prepare a draft single binding system for the Ministry of Health for creating, approving, publishing, updating the CPGs, something you've seen in the McMaster checklist, so to go through whole process, and create at least 40 clinical practice guidelines for areas with the largest defined heterogeneities in the healthcare system. And the question here could be how we know about what are these heterogeneities. This is the role of our second partner, Institute of Health Information and Statistics, because we have analysis about the healthcare system, and for this we know actually which are the biggest issues for us. And also this could be raised from our clinicians and medical associations would actually can target some particular issues they are facing in the practice. Then the design of the system of education of the person involved in the creation of the guidelines and subsequently using the guidelines. So we currently massively capacity building and educating our colleagues within this project. This is how all works. This is the scheme. of all partners. So you see that we actually collaborating with the teams, we're helping them to develop the guidelines. Once the guideline is developed, a guarantee committee will approve them. Once they are approved, they will be actually displayed on our portal and also enforced by the some legislation, but not all of them. That will be based on the guarantee committee approvals. So for the objectives and where we are with the guidelines, so within this project we have 4 key objectives. Many of them I already mentioned, so I will show you actually where we are currently. So the 4 first outcomes, which was the first month, were for 60 months in the project. So we developed the methodology, and there were a proposal of the first 5 pilot topics. All of these first file of topics were actually already submitted to guarantee committee and approved, if I'm not mistaken. But Professor Žaloudík is a member of the guarantee committee, so he's knocking that yes. So they were approved yesterday, the last 3. I was unfortunately not there because I was here on a European directors meeting. So the first 5 topics, the guidelines for colorectal cancer, chronic lymphatic leukemia, prevention treatment of stroke, insulin pumps and glucose monitoring, and the prevention and treatment of cardiovascular diseases. So there's were the 5 first topics. And currently now we have prepared another 10, which we will start work on soon. On some actually already our methodologists are consulting this already with our clinicians. And then the outcomes for key activity 2, nomination of the guarantors of the guidelines and development of the methodology, it's already happened. The final methodology will be published actually last December, but as I said, still as the evidence-based medicine and the methodologies are evolving, we will evolve our methods as well. Well, we are not here yet. It will be 4 or 5 years. And the goal is to develop at least 40 guidelines. So all of you are developing guidelines, so you can imagine what's in front of us for the next 5 years. And for the last, the national portal, this is something we already have. We are developing e-learning study materials. This will be published. Also, part of the e-learning will be actually outcomes of this symposium, where actually the keynotes will be available. So the people who missed this conference, they will have a chance to actually see it again online. That's the reason why we have this camera here, so they can still learn. The training of the developers of guidelines in the methods, that's what we are currently working on. 2 conferences, so this is the first one, so you see we are in 50% of this. The last conference will be in the end of the project, and then finally about 40 fully supported people who are trained in the process of guideline development. So this is what we want to achieve in a project. Some of the fundamental suggestions, what we have some tips and tricks by the guideline developments based on evidence and some expert opinion we have during the guideline development with our colleagues. It's a selection of suitable members of the working team. Well, what we recommend is the decent English, enough of time, which is a big challenge for everyone in here, you know, it's but it really, we have to find people who have the time to actually write down the guidelines. A willingness to learn something new, and experience with evidence-based medicine, at least basic experience. So for this we capacity build and we offer our methodological workshops, also supported by our Czech National Center of Evidence-Based Healthcare Knowledge Translation, which is located here in Brno. So we offer much more trainings than are actually offered by the project itself. The specification of the topic, narrowing it, defining the PICO question, searching first for existing guidelines and high-quality systematic reviews, then actually developing it de novo. Collaboration with methodologists, collaboration with information specialists. We have, you know, a perfect information specialist, and also, let's say, our right hand in a project, which is Dr. Kellnerová, sitting there. And again, collaboration with our international colleagues in knowledge sharing and combination of templates and software. We currently enforce Grade Pro, which is now in a process of translation into the Czech language as well. Thank you very much for your attention.
All right, so we can start discussion. It's not working. Sure.
It is?
All right.
No. You know, I'm a wise for IT.
Yes, you are wise in for IT. Thank you.
Okay, so do we have some questions?
So, do we have some questions?
Hi, thank you for a fabulous presentation. It looks a really exciting initiative. What is your methodology for deciding on when an existing guideline or systematic review needs to be updated?
Mm-hmm. Yeah, very good. Thank you for the question. It's well, when we adapting guidelines, that's one of the criteria we look to. When actually the guideline by the society will be updated, and our guidance for actualizing of the guidelines is that at least 3 years, and every time if there is new significant evidence which came to field, so then we will regrade and look again to the recommendation.
Hello, congratulations to your project. I just have 2 questions. How do you decide whether to adopt, adapt, or adopt a guideline? And the second one, you said that you will make 40 guidelines in areas with the most heterogeneity in interventions in treatment, I suppose. What was the methods that, or was there any research that preceded these decisions? Which of the 40 areas will that be? How did you decide?
Yeah.
Okay, thank you.
Okay, thank you. So for adaptation, it's of course based on our team, based on the guarantor. They look to guideline, they look if the guideline is of high quality. So we use Agree tool. Another condition is that they are developed based on great methodology. Yeah, because then it's making the whole process much easier for us. And the next one was if the guideline is actually when will be the time for actualization. Yeah, so those are the basic criteria we have. And then to adopt or adapt, it's based on if our healthcare system actually allows what is recommended. Yeah, because there would not make sense to recommend something, and we, for example, our health insurance is not paying for it, it's not reimbursed it, or we don't have the tools in our country, or we don't have the expertise. Yeah, so in this case, there will not be adoption, but adaptation of it. Yeah, to be useful, the guideline. For the next question, how we actually find the focus of the for these 40 topics, as I said, is based on the epidemiological analysis of our second partner, which is the Institute of Health Information and Statistics, which is giving this analysis to the guarantee committee, and the guarantee committee is this role will say, okay, this is the important area based on the analysis and based on the need. Members of the guarantee committee are very important people, members, stakeholders who are members of it, and they understand and very know about the Czech health system.
I hope that it wouldn't be impolite if I add something, because I wouldn't ask my colleague. I can ask him anytime, but I should add something from the view of this state, what we are meaning just now. If we are just starting to write some history of this process, there was a long prehistoric period of 20 years. We had to change 20 ministers, and only the 21st could recognize and adhere to the concept of these clinical trials. This is the first thing. Dr. Klugar already mentioned that we had something like 2,000, let's say not guidelines, but recommendations. Yeah? And, but it's not a question to write it. This is a question how to implement it and how to support it. Also, that's why I was asking about insurance companies. And of course, the minister should say something. We need it. We want it. This is our policy. This is our concept. And so, if you are changing only recommendations, if you are changing the ministers in high frequency, like in Czech Republic, statistically, you could pick up one of them who could adhere in future. So we need to change 20 ministers to find the first one who could say that this is really the state policy. Before it was something like amusement of some clinics and companies. So this is very important that it has support. I don't like politics too much, and more I dislike it as I'm now active in that. But for some, if you have the clear concept, so sometimes the politics can be helpful to put it as a vivid and to put it into the alive position. Otherwise, it would be simply the academic activity.